If you're on testosterone replacement therapy, do you have to aspirate prior to your injections? This is one of those topics that carries a lot of controversy with it, and it never seems to die, never seems to cease. So that's why I want to talk about it today. For those of you who don't know what aspirating is, it's a technique, sort of an injury prevention measure, in which when you administer an intramuscular or subcutaneous injection, say if you're going to the deltoid, what you'll do is you'll withdraw the plunger, and you're supposed to withdraw it minimally 5 to 10 seconds. That's what the textbooks have historically recommended, was an aspiration of 5 to 10 seconds. And the goal is to see if there's a blood return. If there is a flash of blood, then you are inside a vessel. And then you're not supposed to inject it because the fear that you could cause an embolism of some sort. I've been perusing a lot of literature surrounding this topic, and it appears the literature has actually changed their stance on this. Historically, they used to say, hey, you need to aspirate. If you're in a vessel, don't administer it. But the literature has changed now. They're saying, you know what? If you're doing deltoids, if you're doing vastus lateralis, which is the side of the leg, if you're doing quadriceps, or even ventroglute, you really don't have to aspirate. And the reason is because these are not highly vascular areas. If they were highly vascular areas, then, hey, we'd probably be doing blood draws and doing IVs from these locations, but we're not doing that because, again, they're not highly vascular areas. Now, I was reading some pediatric literature, and this was pediatric literature in terms of vaccinations. They actually recommend doing an aspiration if you're doing the dorsoglute area because you're close to an artery in the glute. Now, dorsoglute is way back here, way on the back towards the glute area. So some of the pediatric literature does suggest if you're doing there, you probably should do an aspiration. Obviously, that doesn't apply to y'all because this audience are adults and you're not worried about injecting vaccinations into the gluteal artery. Interestingly and unrelated, I did come across some literature regarding the coronavirus vaccination, and it suggested you should have that aspirated because if that coronavirus vaccine goes intravenous, it does run the risk of causing myocarditis. I mean, imagine that. I think thousands of us have suspected that for years now, but hey, lo and behold. So long story short, do you have to aspirate prior to TRT injections? No, you don't. It's totally up to you. If you want to, sure, go for it, but don't think you have to. And on top of that, the recommendation was that if you do an aspiration, it should be administered for roughly 5 to 10 seconds. But quite frankly, I don't know anybody who actually does that for 5 to 10 seconds. I was even taught when I was in school, you inject it, you briefly pull it back, and then boom, if there's no flash, you go for it. I was never actually taught 5 to 10 seconds, but that's what the textbooks actually show. So hey, again, if you want to do it, cool, go for it. I'll have references up after this. If you enjoy this video, give us a subscribe. We appreciate y'all watching, and let's continue to learn together.